With 349 new deaths in a day, the number of coronavirus fatalities has surpassed 2,000 mark in Italy. Well, we believe that the ICMR is holding a press conference at this moment. Let's listen in.
Yet in stage 3, clearly, as of now, and whatever data we have, and we will have Dr. Murirka talk about the data that has been analyzed for random samples for both SARI and as well as looking at the COVID-19. So we've had several discussions. The expert committee met yesterday and has given a revised protocol for testing for COVID-19. The first one was given on the 9th of March, and the second one has been given on the 16th of March and finalized today. So we will be talking about that testing protocol, and then we will talk a little bit about guidelines for private sector laboratories and what is the status of our labs that we have at the moment in the country. So I think I would just say that the current testing strategy is that all asymptomatic patients who have undertaken international travel should be home quarantined for 14 days. They should be tested, that's the first point, tested only if they become symptomatic with fever, cough, or difficulty in breathing. If test is positive, they should be isolated and treated as per standard protocol. So this is the first group. All asymptomatic patients who have undertaken international travel in past 14 days. They should stay at home for 14 days, and they should be tested only if they become symptomatic with fever, cough, difficulty in breathing. The second is all contacts of laboratory confirmed positive cases. They should stay at home quarantine for 14 days. They should be tested immediately if they become symptomatic with fever, cough, or difficulty in breathing. Third is the healthcare workers managing respiratory distress, severe acute respiratory illness, should be tested when they are symptomatic. So this advisory has got 3. All asymptomatic people who have undertaken international travel, if they become symptomatic, all contacts of laboratory confirmed positive cases if they become symptomatic, and third is healthcare workers managing respiratory distress, severe acute respiratory illness should be tested only if they become symptomatic. This is in terms of the current testing scenario guidelines, and the guidelines for we are also now, I'll give you the status of where we have in terms of labs, and it may be wise to have more time for questions than me talking. The government is currently, the laboratory expansion of ICMR is engaged. We are expanding our number of laboratories, and as we speak today, we have 72 functional laboratories in the ICMR system. This is ICMR, Ministry of Health system. We have also engaged non-ICMR, Ministry of Health, government laboratories include CSIR, DRDO, DBT, government medical colleges, and we have 49 of those labs which will start testing by the end of this week. I think that's 22nd or 23rd. Would you like to commit on a date?
I would not like to commit on the date.
By the end
right
of this
now.
week, 50 more labs, approximately 50 more labs in the non-ICMR system, which are government laboratories, in the DBT system, DRDO system will be activated. So 72 plus 49 will be active by the end of this week. Now, we are also operationalizing, the ICMR is also engaging with high quality private laboratories that include NABL accredited laboratories to understand the modalities, to increase access to the test while ensuring appropriate safeguards, and I can talk about what are the guidelines for private sector laboratories intending to test. Here I want to emphasize also two more points, that we are also operationalizing through two high throughput systems, which are the rapid testing laboratories. Two of them, we have already got the systems. We are getting the reagents to start them, and they will be operationalized in two locations, and they can test up to 1,400 samples per day in those labs, and we are operationalizing them by the end of this week.
So the locations?
You can note your point, and we'll answer all of them later. Yeah, please let me have. So, in terms of the stockpile of reagents, we have already placed orders for 1 million probes. Reagents and primers are unlimited. Reagents, primers are unlimited in the country because they are here, but probes, we have placed an order for 1 million, and we should have them very soon. We have also requested the WHO to provide us 1 million probes. So the following have happened: 72 labs, ICMR system; 49 labs, CSIR, DBT, DRDO, government medical colleges. Third, high throughput systems, 2 of them, 1,400 samples per day, to be activated by the end of this week in 2 sites. And we are requesting to get more of those high throughput systems, but that may take time. High quality private labs, we are engaging and trying to encourage them to do as soon as possible to help us out, although the numbers of those labs are not huge. They are limited labs in terms of PCR machines, but we are in the process of trying to get them on board as soon as possible. Advisories for testing I've already told about. They are being updated. The first one was on the 9th of March. The second is on today, that is 17th of March. And in terms of, do we talk about anything else you would like to talk about? No, or we open to questions? Now we open to questions. Yeah, I think that is better because that is more informal. Yeah.
I will request one by one. Please ask one by one.
One by one.
You can introduce yourself and ask one question.
Yes, sir. I'm Priyank from Times Now. There are 2 set of questions, although there are 10.
One at a time.
Yeah.
Only one question per person, and then we repeat it.
So private labs have raised question that who will collect the samples and what tests are approved as of now, and rapid tests of both antibody and antigen agents based are now available. When will they be available in India? So basically the private labs are asking that who should be available, whose samples can be taken and where their samples can be collected, and what should be the process?
Sure. Dr. Nivedita.
So first of all, when you talk of the antibody-based test, so when you talk of the antibody-based test or other commercial assays, ICMR, National Institute of Virology, is in the process of validating these assays. Today morning only we had a call with them and we asked them about what is the scenario of validating the antibody-based tests. So the people who claim that they have antibody-based tests have yet not been able to deliver those kits for validation at NIV. We are expecting the first lot, that is 2 to 3 kits, to be delivered by Friday. That's what we understood. And a total of 8 of them are there, the antibody-based assays. But we will validate them at NIV as and when the kit manufacturers supply those kits for validation to us. There are a few real-time PCR-based commercial assays also. Again, 8 of them which are undergoing validation at ICMR NIV Pune, and we would be recommending those kits based on the validation results that NIV Pune will be giving very shortly, and based on the availability of the kits. So that's, and when you talk about the sample collection procedure by the private labs, We all understand that the patient should not be called to the collection center. Otherwise, if the person is COVID-19 positive, then other people also stand a risk of getting infected, involving the laboratory workers. So there is a set of biosafety, biosecurity precautions which should be taken by each of the private laboratories while handling these specimens or collecting these specimens. And secondly, it is also advisable if they could create separate collection facilities or sites where COVID-19 suspect patients could come and give their samples. Those modalities have to be worked out, but the biosafety, biosecurity precautions should be strictly adhered to. Otherwise, risk of spread of infection increases.
Thank you.
Can you elaborate a bit on the private labs? As of last week, you said that there is no need to increase private labs as of now. So, what made the government get the support of private labs, and how many private labs are there in the nation?
Yeah, we were approached by a lot of private players. They would like to commit for the country and help out. So we appreciated that, and we have requested them also. At the present moment, the current labs that we have are not fully utilized, and I reiterate, we have them working, and we are scaling them up at, say, an average of about at least we have 72 plus 49. What is that total to? 121 laboratories. So we've scaled them up very fast and very rapidly. We have now the private labs. We are now the limiting step for engaging any more lab is the probes. Primers we have. So anyone who of the private labs who have procured or are procuring the probes, many of them have said that they'll take 7 to 10 days to procure the probes, because we have enough probes for these labs, for 121. We are ready to give the positive. We would like to give the positive control to the other labs and start them as soon as possible. But the limiting step is getting the probes. So as soon as they get the probes, we will be delighted to augment them as soon as possible. How many have you talked to? How many are NABL accredited? I think 51 are NABL accredited.
51 NABL accredited, but we are doing the mapping of these laboratories further and talking to them in terms of what are the facilities available and all. That exercise is ongoing.
So what was the price?
I will read out what is our advisory, just if you don't. Laboratory tests should only be offered, this is for private, offered when prescribed by this is number one, qualified physician as per ICMR guidance for testing. Our guidance of testing should be followed by a qualified medical, which is simple, it's on the website. Since the guidance evolves periodically, the latest revised guidelines should be used. Is that clear? The second is ICMR will share the standard operating procedures for laboratory testing and provide positive controls for establishing the test as soon as the concerned private laboratory has procured the primers, probes and reagents as per SOPs. Adoption of commercial kits for testing NIV should be based on validation conducted by ICMR NIV, which are SOPs are placed, they get those probes, we will activate them. We will give them the positive control. Appropriate biosafety and biosecurity precautions should be ensured while collecting samples. Fairly simple. All the private testing laboratories ensure immediate real-time reporting to the state officials of the IDSP, that is the Integrated Disease Surveillance Program of the Government of India and ICMR, for timely initiation to contact tracing and they have to, that responsibility will be theirs to identify. The responsibility of getting the reagents will be theirs. Getting the probes will be theirs. Getting we will give them the positive control, we will give them SOPs, and we'll be delighted as soon as they get that, we will give that to Bill. ICMR also strongly appeals that private laboratories should offer COVID diagnosis at no cost. They have come forward to help as a national crisis. If they it will be appreciated. It is an appeal.
No cost from the patient or not even from the government also?
I'm talking on behalf of ICMR, not on behalf of the government.
So they'll bear the cost, sir. Who will bear the cost?
Or next, any other question?
Who will bear the cost, sir?
As soon as they come forward, once they start, they can engage with the government to decide.
That will be the condition, right?
No, it's not a condition. It's not at all a condition. It's an offer. It's an appeal. We are just appeal. We appeal to them to give it at no cost. And many people.